Welcome to Slow Medicine Radio. Our host is integrative medicine Dr. Michael Finkelstein. Michael offers medical advice from a holistic paradigm, including both medical and metaphysical philosophies from the full spectrum of human experience. Slow Medicine Radio offers fresh ideas on how to attain a state of wellness that seems distant given the limitations of today's medical paradigm. It introduces you to thought leaders who connect the dots between theory and practice, examining health from a broad perspective with regards to medical diagnoses, conventional and alternative therapies, healthcare policy, and related topics that warrant further thought and discussion. Slow Medicine Radio does not prescribe to take this or do that. Instead, it offers an open-minded, intelligent, and practical approach to living, resulting in greater health individually and collectively. Here is Dr. Michael Finkelstein, the founder of Sunraven, the home of slow medicine in Bedford, New York.
Welcome to Slow Medicine Radio. I'm your host, Dr. Michael Finkelstein, and joining me today will be my friend and colleague, Dr. Kenneth Pelletier. We're going to talk to you about the status of healthcare in the United States and the growing importance of integrative medicine. But first, I want to thank you for listening and dedicate myself in this show to helping you achieve the level of health you want and deserve. And I want to invite you to call in at any time. The show is meant to be thought-provoking and useful, so your input is welcome. The number to call in is 914-636-0110. Slow Medicine Radio will air every Monday at 5 o'clock here on WVOX 1460 AM or worldwide at WVOX.com. And Slow Medicine Radio is sponsored by the Slow Medicine Foundation in Bedford, New York. And for more information on the work we do there, please visit our website, slowmedicine.org. And now on to the show. My guest, Dr. Kenneth Pelletier, is a highly renowned and accomplished physician, author of 12 major books, professor of medicine past or present of some of the most prestigious teaching universities in the world, namely UCSF and Stanford, and the University of Arizona, where we share in common. Dr. Pelletier has served on a number of world and political agencies and is the director of the Corporate Health Improvement Program and has another page worth of accolades and accomplishments. All of this, and two books in particular, stand out for me for today's discussion, namely Holistic Medicine, From Stress to Optimum Health, and New Medicine, Integrating Complementary, Alternative, and Conventional Medicine for the Safest, Most Effective Treatment. Dr. Pelletier and I recently worked on a series of articles together for the Huffington Post and other publications, reviewing the changing culture of corporate America in relationship to supporting individual health. And I wanted to speak with him more now with you on the subject of healthcare and where it's going. Ultimately, I want to share with you ideas about how you can make the best of the current circumstances, which are not always the easiest to deal with, and often leave us frustrated by the level of support we receive from the establishment. So, Dr. Pelletier, welcome to Slow Medicine Radio.
Thank you. Thank you for the invitation.
Well, you know, we've had several conversations over the last several months, largely focused on corporations and what they're doing now for people who work for them and maybe even in the lead in terms of a shifting culture in America. But since people are listening while they're driving their cars right now home from work or to work or their kids somewhere, I want to really focus our conversation on the individual and ask you one question to start, and then obviously, let's see where it goes. But the question I have is, given your vast experience and your lifelong passion with regard to helping people be healthy, what do you think, where we are right now, is the biggest set of challenges for individuals who want to achieve optimum health?
It's a very challenging first question. I think several factors really govern our ongoing state of health, day to day, week to week, year to year. One is stress, and there's absolutely no question that our culture, our environment, both physical and emotional, is becoming increasingly stressful. Many studies, it's implicated in heart disease and cancer, intestinal tract problems, et cetera. So the inability, if you will, for us to manage the stress that we've created, not only in our work life, but in our play, in our homes, in our sleep, that's a big factor. Secondly, certainly, as you know, is nutrition. We're facing a global obesity epidemic. Certainly here in the United States, obesity, insulin resistance, and all of the attendant complications to obesity have become overwhelming. And that's due to poor nutrition. It's due to lack of physical activity, which are two major contributing factors to our states of health or illness. The other is a little more intangible, which is a sense of purpose. And this becomes critical because we do know that when people are under stress or when people have to make life and death decisions, when they have a sense of purpose, why are you doing X? Why are you continuing in that job? Why are you not speaking up? Why are you taking on more and more than you can possibly manage? Their sense of purpose or not determines if that's going to affect them or not. You can have the same person with the same stressful events, same diet, same exercise, etc., same toxic environment, but if they have a sense of purpose, it does not affect them in a way that in the same way that if they do not have that sense. And that's missing very often when we talk with people now. So those are at least a few. And I think the last thing I would add is certainly the toxic environment. The most obvious example is Beijing with its overwhelming air pollution. We know that air pollution is linked to cardiovascular disease. That's just one example. Mexico City has overwhelming air pollution. 20 of the major cities in the United States have overwhelming pollution. So it's the physical environment and also the sound environment. I was struck by a documentary I watched a couple of nights ago. It's called The Sonic Sea, which talked about how the oceans are becoming polluted with noise and is really having a highly detrimental effect on the higher mammals, the whales, the orcas, the dolphins. And it reminded me that we, too, day in and day out, live in a sonic sea of noise, and that has a major negative impact on our health and well-being.
Yeah, so those, I would agree wholeheartedly with all of those, and I bet people listening could list other things that plague them in one way or another, like our relationships. But the question I have for you is, in light of that, in light of your outline of some of the primary problems, when we look at the healthcare system that supports us, that people think of when they're sick, and that they even think of when they're well, trying not to be sick, I would say that the system itself does very well, maybe gets a really high mark for acute life-threatening illnesses at the moment of that type of event. But I'm wondering what you would grade our current healthcare system as it relates to these things you just mentioned.
Oh, well, I would totally agree with you that in terms of acute episodes, trauma, injury, emergency room, surgical procedures, some pharmacology, conventional medicine is absolutely superb. However, and that's the big however, in reality, we do not have a healthcare system. What we have is a disease management industry, and that's not pejorative. It's simply descriptive. Disease is the province of medicine. Management follows, and it is not systemic. It's not a system. It's so scattered and shattered and broken that it's really not system. So we don't have a healthcare system. We have a disease management industry. It's the I believe the 10th largest industry in the United States is the provision of medical care. So what we have is a system that does not deliver the prerequisites for health care. And so that falls on the schools, on churches, on communities, on the private corporate sector, because if you look at the total budget in the United States, which is now over $1 trillion a year, less than 3% of that is spent on anything that we could consider to be prevention or promoting of optimal health. So just by our expenditure within the system, you can predict where we're going to have successes and where we're going to have great deficits. And where we have great deficits is in the provision of guidelines, materials, information, assistance, and programs that promote optimal health.
Well, that really frustrated me when I was practicing medicine conventionally, because I understood that I didn't have the tools. I wasn't trained in medical school to help people deal with those things. So I thought I did pretty well when I was prescribing drugs for chronic conditions to help manage them, although I learned differently later on that some of the things I thought I was doing well intended were actually hurting people down the road. People are well aware of the side effects of medications and a lot of medical interventions. So I'm frustrated. I still remain frustrated. And what brings me to have a show like this is to echo the dialogue that I think already does exist, which is what can people do? I mean, they're not going to go, what I think, they're not going to go to their doctor, their primary physician, and get answers to these questions, or at least have the time to really spend to devote considerate thought onto how to organize a life, reorganize a life to deal with stress, nutrition, purpose, toxic environments, the sonic sea. What can you point people toward as a way to recapture control of their own life, even though, they've got this system they're sort of dependent on? I think we need to encourage people to break away from it a little bit, at least when it comes to how they take care of themselves at home.
I would agree with that. The key to me is the phrase self-care, which is there really is a huge amount that we can do as individuals. Certainly, every time we consume a meal, we can be sure that it has the least amount of toxic substances, it has maximum nutrition, that we eat a modest amount, that we really pay attention to what we're eating. That's something we have to do. You have to eat every day.
Right.
That's something that we can do and do consciously and do much, much better. Just to become physically active, to park your car away from the building so you actually have to walk to the building or bicycle to work or walk to work if possible. Take the stairs instead of the elevator. So just being physically active, getting up every 10 or 15 minutes from your desk, walking around your desk or around a workstation, just becoming a little bit physically active, the amount of calories it burns, the amount of flexibility it provides in the body, again, very positive. Stress management, we can all learn. There are 600 and some odd specific forms of stress management technique, any one of which we could learn very easily. And the simplest thing is to pick anything that relaxes you, a sound, a visual image, a prayer, a phrase, whatever it is, and just focus on that. Breathe deeply 2 or 3 times, let go of whatever was just stressing you, and come back to your task at hand. That's something we can all do. We could certainly, within our homes, be sure that we don't bring in toxic substances. So eliminate the cleaning, supposed cleaning products, the fixations we have around germs and bringing in germ-killing detergents and cleansers. Get rid of those. Those are, one, they don't work, and two, they are really detrimental to our long-term health. So things that you bring into your home, all of these, sound, we can in fact reduce the noise in our homes, reduce the volume on televisions or radios, or stay off our cell phones. The constant addiction to cell phone activity, the light is stimulating. It disrupts our sleep. And many people will go on their cell phone as the last thing they do at the end of the day before going to sleep. That's very toxic. So the reality, and we could make a list 20 times longer than this, of all of the little things, and it is all of these little incremental measures that we can take day in and day out that ultimately makes a huge difference as to whether we experience ill health or optimal health.
Now, I'm thinking that most people, when they sit for a moment to just think about those little things, the things that they can actually do incidentally in the course of their lives without really devoting significant amounts of time to change things, know this. But yet I find, because when I share this with people as well, especially people that come to Sunraven to see me privately in consultation or to one of our programs, people still share with me that they're finding it difficult to execute a plan that includes some of those things. So what do you think's behind that?
Well, probably a lot of things are behind that. One is I find that many patients are depressed. And when people are depressed, it makes them hard to implement, execute, and stick with a plan. So we need to address the issue of depression, which is the most pervasive condition we have in the United States. It's the least well recognized or diagnosed in primary care. So that's, I think, a big underlying factor. Secondly is we really do not know a great deal about behavior change. We know how to we know how to stop smoking. We know how to change our eating habits. We know how to walk to work one day. But what we don't really know how to do is sustain behavioral change. And if you look, many companies now have coaching programs, or there are coaching programs available commercially at very low cost for people that help people once you decide to make a significant positive change. A health coach can really help you to do that. And I'm actually very optimistic. I don't think we need physicians cannot do this. There aren't enough physicians, and it's not a medical issue. It's one where you need exercise physiologists and nurses and psychologists and health coaches all working together and helping individuals to sustain the change once they decide to make it. So the issue is not so much deciding to change, because people who always, the average number of times that people quit smoking before they succeed is 8 or 9 times. That demonstrates how difficult it is to sustain that one behavioral change, even though we know how toxic it is. That same principle applies to virtually every other change we attempt to make.
I would add one more thing, which is I think community can make a big difference in terms of whether or not we can be successful with some of those adjustments. If we can find friends
Completely agree.
to support us, tell people, share with people that this is your plan and I need your help and support, encouragement, just the way teammates would in any other environment. I think that's an untapped resource for a lot of people, why we spend so much time at Sunraven developing community. I just want to mention again that those of you listening, you're listening to Slow Medicine Radio on WVOX 1460 AM on your dial. And I'm speaking with Dr. Kenneth Pelletier, a good friend of mine we have had so many conversations with now about the subject of integrative medicine and the needs we have in this country to expand beyond our dependency to some extent on conventional physicians and conventional medicine to bail us out all the time. I think the ideal would be to try to redesign a way of living so that we would not only be healthier in every way to measure it, but we would feel better. Ultimately, our lives would be more positive in many ways, and that we would have much more enjoyment and fulfillment along the way, however long that is. So, Dr. Pelletier, I always want to give my guests an opportunity to share anything that's on your mind. I mean, I can throw a lot of questions at you, but I was just wondering if today something special was going on for you, or a thought that you wanted to have that you want to share with our audience.
Well, one thing is that we talk about how we can become healthier as individuals, as a nation, as a culture, as though it's mysterious. The reality is it's not. The United States ranks last among the 20 post-industrial nations. So if you look at every country in the world against which we gauge our economic performance, you will find the top 20 nations that the United States spends the most of any post-industrial nation on medical care, not on health care as we talked about earlier, but on medical care, all the way down to Greece, which spends literally 1/10 of what we spend per person per year on medical care. And yet Greece ranks higher or better on every single indicator of health recognized by the World Health Organization. Now, someone might say, oh, well, that's the olive oil or, Santorini or, who knows. And partially they're right. But if you look at every nation between Greece and the United States, includes Germany, France, Italy, all of the post-industrial nations, all of them rank higher on the vast majority of indicators of health than the United States. So anyway, the bottom line is that we are spending the most money of any nation on earth and have the sickest population on the planet. That mismatch between expenditures and health outcome is the crux of what we're talking about today. And so what we need to do is to shift, if you will, some of those expenditures, some of that priority back to basic primary care, back to environmental quality, to rebuilding our communities, to restoring a sense of relationship to our spouses, to our significant others. All of those things at a very fundamental level, improving the quality of basic education for our children. If you look at, for instance, let me give an example of the Netherlands. The private corporate sector in the Netherlands does not have a lot of health promotion programs, and I was always mystified by that until I really talked with friends of mine who live there, and they said, well, we don't really need them. because we bike to work. We have a high quality of environment. We have a social support system where no one is ever going to think about being homeless. There's this level of subsistence in the economy. In other words, all of the prerequisites to produce health in a nation already exist in the Netherlands. You don't have to go about creating them. And their physicians are trained differently. They're trained with an orientation much more toward primary prevention, toward the kinds of things we're talking about earlier. So the ability, the lessons, the roadmap, if you will, of how to create more health in a large population like the United States for individuals and collectively, they're out there.
Right.
They already exist.
It's amazing that you said that, because I think it was yesterday or the day before that I was thinking the exact same thing, which is it's being done. What I notice is that for some reason on this part of North America, there is a mindset that that we need money for this, that we need special alignment, special sneakers, special something to get this done, where it's already part of the fabric, the cultural fabric in so many other places. I think Americans in the United States are at a disadvantage because of I'm not sure what it is, if it's corporate greed and dependency on the capitalistic model that gets us to spend our money somewhere else and think that somehow it's in pills or in gyms or in something else as opposed to what we do for ourselves. This is the mindset that I want to shake up a little bit and get people to start thinking differently and maybe moving differently toward a model which does exist, as you say.
Yes, and as you know, I am very apolitical, and a political atheist, if you will. So with that as a caveat, if we just look at the influence of the organized medicine, the hospital associations, big pharma, high-tech medicine, those constitute over 50% of the lobbying efforts in Washington, D.C. You add to that big food, the dairy industry, the meatpacking industry, and you realize that the information that we receive through our media, through our magazines, through conversations in print, all are influenced by a particular perspective, which is more pharmaceuticals, more surgeries, more technology is going to solve the medical crisis in the United States, and that is completely false. That's a dead end. Just one example. There are more MRI instruments in the city of San Francisco than there is in all of Canada. And yet Canada ranks higher or better in that list of 20 nations than the United States. So the answer is not more technology, but the push, if you will, by big technology, big pharma, conventional medicine, is toward a belief system that we've all come to subscribe to, which is more medical technology, more pharmacy, more doctors, more interventions, more surgeries, more, et cetera, is the answer. Right. The reality, as you know, is it's simply wrong. That is the wrong question, and it's the wrong answer.
Right, but somehow, and this does, I wouldn't say irritates me because I want to be more compassionate, and I'm a product of the same society, but it impresses me that for some reason we seem much more susceptible to those capital pressures and the agenda of corporations to pull our minds away from self-care, as you described it, and to dependency on things that we would buy or technologies that would somehow miraculously diagnose us and cure our lives, as if somehow that is enough. And clearly Western medicine is not enough. Dr. Pelletier, we're sort of coming to the end of our time, and we could obviously speak to the subject much more, but what I did want to do is give you an opportunity to share with people listening where they could reach you or find out more about your work. Obviously, your books are available, but did you have a website you want to mention or some other?
Yes, well, my website is simply drpelletier.com. So it's an easy website, just my DR and then my name, .com. And the other is that in the fall, I will actually be publishing my next book, which is on epigenetics, which is how our choices and our environmental exposures literally determine what is expressed or not in our genes. In other words, we are not victims of our genetic endowment. In fact, we govern what our genes will and will not do by the day in and day out choices that we make, like we've been discussing already.
That to me is very exciting, and I'm looking forward to reading the book and speaking to you again on that subject, perhaps many others. But I think that there is hope in terms of how we do shape our minds, in terms of what happens in our bodies and to our whole lives. And we're not just sort of pre-programmed. We're also not necessarily need to be completely ruled by the conventional norms of our culture. So I want you out there as you're driving home work to take some advice from Dr. Pelletier today and maybe tune out a little bit to some of the noise that goes on in your life. Sit and enjoy a meal. Try to find the freshest ingredients that you can and the nicest people to surround yourself with, at least till we speak again next week. And Dr. Pelletier, thank you so much for joining me.
Thank you, Dr. Finkelstein. It's great to be with you again.
Okay, be well. And all of you, you've been listening to Slow Medicine Radio here on 1460 AM WVOX. You can listen to the show every week as it airs live at 5 o'clock on Monday. Next week, in case you've missed our launch premiere from last week, we're going to replay that for the Memorial Day holiday. And then I will be back in 2 weeks with some upcoming guests. I'm not sure who among them, but give you some names. Dr. Mehmet Oz, Dr. Kulreet Chaudhry, Dr. Lisa Rankin, Dr. Kelly Turner, all very prolific, well-known physicians to talk about how you can be healthier yourself. Till we meet again, take care.
With world and national news, here is the latest update.